Good evening, National Baptist Convention USA Incorporated, and welcome to this evening's NBC USA Hope Health webinar, TempleCare Matters. To start, we acknowledge our national leadership, Dr. Boise Kimber, President, Dr. Michael O. Miner, our National Director of the NBCUSA Liaison to the U.S. Department of Health and Human Services. Today's webinar is going to have a very, very special topic. We're going to be talking about Healthcare 2025. Y'all know times are changing, and our National Director, Dr. Michael Miner, will share where we are with our healthcare coverage in America in 2025. Now, y'all, this is such an important topic. I highly encourage you that if you're someplace safe, and you can do so if you're able to multitask, can you please share this webinar? Share the link to someone in your church or convention that may need to be on this webinar, or you can just go on ahead and go over to our Facebook page and hit the share button. This is extremely important information, and we want to get this out to as many people as possible as a trusted source for health information through the Hope Health Ministry, okay? Now, we're also going to share about a couple of other things. Our February suggested health observances that include the American Heart Association's American Heart Month, the National Black HIV Awareness Day, which is February 7th, the NBC USA Hope Wear Red Sunday, February 16th. We'll talk more about that in a second, as well as the NBC USA Hope American Kidney Fund Sunday, which is March 3rd. This webinar is part of our continuing series of First Tuesday TempleCare Matter webinars. And in each session, we delve deeper into the 7 pillars of TempleCare Matters. Now, February, y'all, is Love Month, right? And that is why we always like to talk about heart health. NBC USA family, you know what we do in February. We observe Wear Red Sunday. And we have designated this year, Sunday, February 16th. Y'all go ahead and write that down. That's our Wear Red Sunday. On that day, we are encouraging churches across the National Baptist Convention, all across the nation, to share information about women in heart health. And please be sure to take pictures of your congregation in red. Y'all looking all good. And be sure to share those on your social media platforms and tag us. You can also go to our website, which is www.hopenbc.com, to download a toolkit to support you in this health observance. Now, it is time for our triple-demic update. According to the CDC, nationally, the amounts of acute respiratory illness causing people to seek healthcare, it still remains high. We still have emergency room department visits at a high rate for diagnosis of influenza and for moderate RSV. The emergency rooms report visits for COVID-19 are low, but influenza test positivity has increased to over 29%. COVID-19 remains stable at around 5%, and RSV has decreased down to 7.6%. Nationally, y'all, we are experiencing a wastewater viral activity levels for influenza A at very high levels. And nationally, COVID wastewater viral activity levels are high, and wastewater levels for RSV are moderate. So there's a lot of good bit of contagion out there. COVID predictions for the next 2 weeks suggest that emergency department visits will remain at a lower level compared to prior winter seasons, which is a blessing. Influenza predictions suggest that emergency department visits will remain high and will increase in most states. Now let's begin the focus of this evening's webinar. It is Healthcare 2025. So we're going to welcome our faithful leader, Dr. Michael O. Miner. He's our National Director. And as many of you know, Dr. Miner has been on the front line of health advocacy on not only the local, but also state and national levels for over 30 years. almost 30 years. He attended the Families USA Health Action Conference 2025 in Washington, D.C. a couple of weeks ago. And he felt that it was prudent for us to have this very special webinar to provide needed updates on our healthcare coverage options in 2025. So, Dr. Miner, good evening.
Good evening, Sister Nettie. Good evening. Good evening.
All right. Well, we're really excited and looking forward to your sharing with us. When you mentioned this topic, I was very personally excited, and I've told a lot of people because there's so many changes going on regarding healthcare. We're thankful that you were able to participate in the National Health Conference a couple of weeks ago, and so we have questions about where we are, what we've been hearing about all of these proposed budget cuts to federal government insurance plans, Medicaid, the Affordable Care Act, the whole shebang. Do you have any updates? What can you tell us?
All right, well, Sister Nettie, again, good evening to everyone. And as she said before, we want to make sure we're sharing this tonight. We've done this especially for you all on this evening. Right now, Republicans in Congress are debating a series of budget cuts to offset their expected continuation of corporate and individual income tax cuts. Now, cuts in funding for both Medicaid and the Affordable Care Act are included in these discussions. However, there are about a dozen centrist Republicans from House members in swing districts that see cuts to the Affordable Care Act as a non-starter.
So, considering the fact that all three branches of our government right now are under Republican control, why are these Republican House members opposed to these cuts?
Well, there are two major reasons. First, in the previous Trump administration, when cuts to the Affordable Care Act were much more part of the discussion, about 40 Republican House members lost their seats during the midterm elections. So it would not go well again if these cuts were made. Second, most Americans, including a majority of Republicans, see health care as a right. Health coverage through Medicaid and the Affordable Care Act represent major avenues to ensure that right, especially those uninsured.
So you mentioned uninsured. So what about them? How do the uninsured impact healthcare how are all these changes going to impact them?
Well, uninsured individuals impact us all. How? First, they raise costs for all of us. Hospital systems include uncompensated care in their pricing models. So everyone with health coverage pays more. Second, it hurts our workforce's productivity. Uninsured individuals do not partake in preventive care. They don't have adequate resources to maintain appointments and medications in the treatment of chronic diseases like high blood pressure and diabetes. So they often have to miss work or are very unproductive during the workday.
Okay, that makes a lot of sense. So you've shared with us several times about the Affordable Care Act. Can you just remind us all, what is it and why is it important for our nation's health coverage?
Well, I'm glad you asked this, Sister Nettie. Contrary to the beliefs of many, the Affordable Care Act is not a federal government insurance program. Rather, it is a federal or state-based website that links approved health insurers with consumers needing health insurance. The Affordable Care Act is important on two fronts. First, in states that expanded Medicaid, low-income households without children and/or between 100% and 130% of the federal poverty level are covered. We're highlighting a graphic here that gives you an idea of what these income guidelines are. Second, for those with jobs without health coverage, which there are many people, entrepreneurs and others, it is an opportunity to have health coverage without having to keep another job for health benefits. All Affordable Care Act plans must cover 10 essential benefits, including doctor visits, hospital stays, preventive care like checkups and mammogram prescriptions, and more. No one can be denied coverage for a pre-existing condition. And check this out, Sister Nettie. Being a woman is no longer a pre-existing condition, and women get access to free contraception and well woman examinations.
You have got to be kidding me that was a thing. Redunculous. That is insane. Okay, so thank you for all of that information. Talk to us a little bit about the premium costs. I know that sometimes that is a concern for individuals.
Well, I know a lot of the complaints about the Affordable Care Act was that it wasn't affordable for many people. Depending on how much money you make, you could get help paying for premiums through the subsidies. Under the Biden-Harris administration Inflation Reduction Act, these subsidies were greatly enhanced. That made plans much more affordable, with many low-cost and even free plans available. As a matter of fact, 4 out of 5 people could find a plan for $10 or less with financial help.
That is phenomenal. 4 out of 5 can get a plan for less than $10. Okay, so how can people that don't have coverage and need coverage, what can they do to enroll?
Well, open enrollment for the Affordable Care Act ended last month. However,
Okay.
individuals may qualify for a special enrollment period due to a life change like marriage, new baby, and turning 26. They may go to healthcare.gov to see if they qualify. And we'll put that in the link for everybody. But that's healthcare.gov, and you can go through the process and see if you qualify.
Okay, great. Oh, the team is on it. I see it already in the chat. So it's healthcare.gov for those
Right.
that are also on Facebook. Okay,
Right.
so you mentioned premium subsidies. How would they be affected if the Affordable Care Act is included in these budget cuts that are being considered?
Well, I don't know if you know this or not, but right now, over 24 million people are insured through the Affordable Care Act. That is almost double the number enrolled in 2021. And that's why is that? That's because of the Inflation Reduction Act. Under the Biden-Harris administration, subsidies, as I said before, on the Affordable Care Act were increased. Yes, they were. Now, if the proposed cuts that the Congress is discussing to the Affordable Care Act take place, millions of Americans will find the premiums unaffordable, literally doubling in price, and lose their coverage. Congress would be taking health care away from millions of our fellow Americans.
Which you established earlier, and we already know it should be a right. So that's terrible. Okay, so specifically, who are some of the groups of Americans that could lose coverage?
Well, several groups that could lose coverage are early retirees. We have people all the time that are not quite 65. They're ready to leave their job, they need health coverage. Small business owners and the self-employed individuals, job creators. They don't want to work. They need to work full time to make their their American dream comes true. And they want to be able to have coverage through the Affordable Care Act. Farmers and ranchers, we're seeing now that with the enhancement to the subsidies in the Midwest, there are tons of farm workers who will not be able to make it without coverage through the Affordable Care Act. And other rural constituents, children, people living with chronic conditions, and cancer patients and survivors.
A lot of vulnerable people in vulnerable populations. Okay, so can you talk to us about Medicaid? We talked about Affordable Care Act. Let's talk about Medicaid now.
Okay, now Medicaid, which by the way turned 60 this year, was established in 1965. It was an amendment to the Social Security Act by President Lyndon Johnson as part of his Great Society program. The program was meant to provide health insurance to individuals and families who could not afford or were not provided with private insurance through employment. Now, Medicaid is a federal-state partnership. The federal government reimburses states for a portion of Medicaid costs through the federal medical assistance percentage program. Now, that covers hospitals, doctors, clinics, pharmacies, and nursing homes with little to no co-payments by the beneficiaries. Now, this is a nearly $900 billion, nearly $1 trillion funded, right? $1 trillion funding by both the federal government and individual states. With each state now, keep understand this, each state administering its own eligibility, benefits, and payments rate. And these, of course, are based upon the federal guidelines. As you can see on if you go to the Medicaid website, you'll see those guidelines.
So do all states have similar Medicaid programs?
Well, I'm glad you asked that question, Sister Nettie. A lot of people make that assumption. We've had people that moved from Tennessee to Mississippi, or people from Michigan to Mississippi that asked about it. And no, they do not. Although all states could have expanded Medicaid to cover low-income individuals without children, and others up to 138% of the federal poverty line, most of the non-expansion states are in the Deep South, with the populations most in need of expanded Medicaid coverage. So wherever you are, those that are watching, you need to look at your states and what their particular guidelines are. And if you're moving, or members of your church moving, or in your family from one state to the other, and they are part of the Medicaid program, they need to ensure what the guidelines are in the state they're moving to.
Wow. Okay. And that map there is very helpful. Okay.
Right.
So how important is Medicaid for healthcare coverage in America?
Wow. Sister Nettie, Medicaid is vitally important. Look, today, nearly 80 million people, let me say it again, 80 million people are enrolled in Medicaid across the United States. That includes nearly 42 million adults enrolled in Medicaid, and nearly 38 million Medicaid child and children health insurance program enrollees. That means this: 1 out of every 4 Americans, 1 out of 4 Americans are enrolled in Medicaid. Now, may I also add that Medicaid is the largest payer of long-term care services, nursing homes. A good number of our seasoned saints are dual eligible for Medicare and Medicaid. If Medicaid were cut, some of them, even with family help, would find it most difficult to have access to the quality, affordable care they need.
Okay. So are there any other groups or people that could be like negatively impacted by cuts to Medicaid?
Well, this is something people don't consider. State budgets would take a big hit. On average, some states more, some states less, about 20% of each state's spending comes from the federal government for Medicaid. So we're not talking about 20% for Medicaid spending, but we're talking about 20% of each state's overall budget. The overall state budget, about 20% on average, comes from the federal government in Medicaid funds. So this funding is the primary funder of rural hospitals and a significant source for hospitals serving low-income urban populations. Now, let's think about rural hospitals. They're not only vital for our healthcare, they're also major employers. They're hubs in the communities. They are. And they have a multiplier effect of jobs, other jobs in the communities in which they are located. Another group that will be harmed will be children. Medicaid covers over 40% of all childbirths nationally. Let me say it again.
Wow. Wow.
40% of all the children born in our nation, 40% are covered by Medicaid. Children on Medicaid are more likely to miss fewer school days and are more likely to attend college. Medicaid enables 1 in 3 kids to get early screening and detection services so that they can be prevented from developmental delays and behavioral issues, and health challenges like asthma can be managed. Households will be adversely affected. Families on Medicaid are more likely to have less risk of medical debt, the dreaded medical bill. Health insurance through Medicaid is a lifeline for those fighting illness. It helps them diagnose their conditions earlier, get treatments, manage symptoms, and improve their chances of surviving without going into medical debt. Seniors, we just already said it before, but I want to say it again. Seniors will be adversely affected. Seniors on Medicare are more able to stay healthy and receive needed care, including long-term nursing home care. We would literally be abandoning our seniors if we cut Medicaid. And of course, everyone else would be adversely affected due to the rise in uncompensated care.
Okay, this is a lot. This is a lot. Um, when we talk about children, can you tell us a little bit about the Children's Health Insurance Program? I think most people know that is like CHIP, right?
Right, it's
Can you
CHIP.
share more about that program?
Okay, well, the Children's Health Insurance Program was created in 1997 during the Clinton administration. While Medicaid covers households up to 138% of the federal poverty level, CHIP covers up to 200%. So CHIP was brought out because for the households who made just a little bit more. Also, CHIP, unlike Medicaid, it must be reauthorized by Congress. The current reauthorization is up September 30th, 2029. Now, like Medicaid, CHIP plays an important role in helping children stay covered by health insurance. And we have a little JPEG on that gives you some overview of the difference between Medicaid for children and Medicaid and CHIP.
That's very helpful. That is very helpful. Okay, so Dr. Minor, you talked about the Affordable Care Act, you've talked about Medicaid, you've talked about CHIP, Children's Health Insurance Program. What about Medicare?
Woo, Medicare. Oh my goodness. All right. Medicare is a health insurance program primarily for U.S. seniors 65 years or older. However, in some cases, you may be younger with certain illnesses or conditions, including end-stage renal disease, disability, or ALS.
Yeah, I think probably everybody that's on this webinar knows people that are Medicare, or if not themselves. So
Right.
tell us a little bit more about it. What exactly does this cover?
Well, Sister Nettie, to answer this question, we would need an entire webinar by itself about Medicare. And we do
Okay,
have one plan. We thought about it, and in September we're going to have a whole an hour on Medicare in anticipation of Medicare open enrollment. Uh,
that's
but
great.
briefly, but briefly, coverage depends upon whether an individual is enrolled in traditional Medicare or Medicare Advantage plan. We highlighted that a little bit here on the screen. For example, traditional Medicare does not cover dental or vision services, while Medicare Advantage plans might. Again, we would need to design an entire webinar to cover the Medicare coverage, these Advantage plans, Medigap, all those things. And look forward to September. We'll have that there. And I will not be the person doing it. We have a couple of people on our team that are specialists that'll be able to handle that for us.
You know, I see those commercials all the time where they're talking about the gaps in the Medicare Advantage. And, you know, watching the commercials that I think are designed to be very informative, I end up more confused than before the commercial. So I am so grateful that this is going to be happening. You said it's going to be in September, correct? In September?
Yes, it'll be in September.
Okay. Okay. So let's go to another group. What about undocumented immigrants?
Undocumented immigrants. Well, that is a topic of conversation in our nation right now. Now, that's a touchy subject. However, understand this, undocumented immigrants comprise about 5% of our American workforce, over 8 million individuals. I'm not 800, 8 million individuals. I'm thinking about uh, the 350 million people in our nation. Now, it seems like 8 million people is not a lot, but think about this. They have a disproportionate impact, these 8 million undocumented immigrants, on our national economy. Why? They work in sectors that most Americans would not work, and like agriculture and in the hotel, hospitality industry. They work
Mhm.
for low wages. Work for low wages. Now, look, if they were working for a living wage, grocery prices would be high, construction costs would go up, landscaping would be out of this world, just to name a few things. And inflation would greatly increase. We sadly, as the pace of these deportations are going, by the summertime, we'll see some of the impacts of the disappearance of this undocumented workforce.
You know, in all of these things that you mentioned, sometimes people, I'm gonna say people, have a tendency to kind of be like us and them, and that's not me, and this doesn't affect me. But in all of these things, we see that, we're really not independent, we're interdependent. There's a lot of connections in all of these things. So yeah, this is very informative. So why should we be concerned? I understand what you mean about the wages and the importance that they are to the economy. Why should we be concerned about healthcare coverage for undocumented immigrants?
Well, like everybody else, they get sick. They need
Right.
access to
Amen.
preventive care. And
Yeah.
truthfully, we're looking at a healthcare issue, not an immigration issue. After
Mhm.
all, undocumented immigrants pay taxes. When I tell you what, when they go to the grocery store, I don't see the grocery store asking, "Are you undocumented person or not?"
Right.
You go in, you're just going to pay tax. When they buy gasoline, it's not going to ask for you undocumented. So they pay taxes, and believe it or not, many are involved in the healthcare industry, delivering vital support services to help underpin our expanded, huge healthcare industry in America.
Okay. So bring it all together for us, Dr. Miner.
Okay,
Can you
wow.
just kind
Do
of
this.
like what are our options?
All right. So this is a question that we thought we addressed tonight because, believe it or not, in my travels across the country, even people that I think ought to know don't even know when it comes to children, church members that don't have health insurance. All right. Well, the number one option to keep or obtain health insurance is from your employer. All right. And Duke will put up that JPEG for us. About half of Americans have employer coverage. Okay. Now, with employer coverage, children aged 26 or younger and spouses may keep or attain insurance through their parents' or spouse's employer health insurance plan. Now, if you lose your job, which under the current environment may very well happen, you may keep your job coverage through COBRA after separating from your employer. However, it is really expensive because not only are you paying your portion, you're paying the employer's portion. If you lose your job, you may want to consider signing up for coverage through the Affordable Care Act. Now, I said open enrollment is over, but if you were to lose your job, you'll have a 60-day window that you can have a special enrollment period that you can go ahead and sign up for coverage. Or, if it's doing open enrollment, which is November 1st through January 15th, you can do it then. Now, beside all that, you should also see if you or members of your household qualify for Medicaid or the Children's Health Insurance Program, CHIP, Medicare, or the Veterans Administration. I do a lot of work in the state of Mississippi, and every week we get inquiries from people who don't know they qualify for veterans benefits. The rough rule of thumb I always say is that if you got a piece of paper that says you were honored discharged from the military, or you served at least one day active duty, check it out and just see. The worst thing that can happen, they tell you don't. The best thing is that you'll get covered. And if all else fails, you should search for the nearest community health center. Some of them are just basic community health centers. Some of them are fairly qualified community health centers, and they receive special funding through the U.S. Department of Health and Human Services. Now, although most community health centers do not offer free care, they offer services on a sliding fee scale based upon a person's income and other factors. Yes. Whew, I got through all of them.
Okay. All right. So those of you that are in the webinar, y'all put a 1 in the chat if you learned anything new. Like I think I learned a lot. You went employer, COBRA, Affordable Care Act, Medicaid, CHIP, Medicare, veterans, community health centers. There's a whole lot. Is there look at all the ones, Dr. Miner. Thank you for doing this. Thank you. You covered so much for us. Is there anything else that you would like to share?
Yeah, there is. I'm really concerned about the price of hospital services. I really am. That was one thing that really shocked me at the conference. According to the Baker Institute at Rice University, hospital services prices have surged more than 200% between 2000 and 2022. This increase is greater than any other good services category, anything else. That also includes all other medical services. All of the medical services besides hospital services only increased by 130%. And the overall inflation rate, we had COVID-19 coming in, was 75%. So this was just a huge increase. Now, this is
Wow.
what they say. Look, hospitals often justify their price increase by citing higher expenses due to labor shortages in the healthcare workforce resulting from the
Okay.
pandemic. However, hospital prices have been rising faster than those for other medical services long before COVID-19 pandemic beginning in 2020. Now, this is what a
Mm.
recent report in the Health Affairs Scholar said. Um, Compared to any other professional services, we're talking about medical doctors, we're talking about dentists, we're talking about eye care providers, any type of other providers, they're still way higher. They found that prices for hospital services have been rising faster than those of other professional services in medical area every year since 2006, every year. Now, the Baker Institute study suggests something. The higher prices are not simply a response to high operating costs, rather, they are associated with large hospitals operating profits.
Help us.
Profits. To promote affordability in the healthcare system, negotiated rates for health services should remain a high priority for policymakers. I encourage our local congregations to ask your parishioners to request itemized bills to begin comparing pricing. One example they gave us in the conference was that before primary care practice was folded into a major for-profit hospital system, there was a test that only cost $50. After they got involved in the hospital system, they couldn't get it done through the primary care. They had to go through the hospital system. After they got through adding the fees for the doctors that were at the testing place and the place for the testing place facility and the hospital system, everything, that $50 test cost over $1,200. Just let that soak in for a
What?
second. Yeah, because when you go in for these, when you work for your primary care, they're just gonna go to maybe the nearest place and it just work with your local doctor. But once it's part of a system, there's all these other ancillary costs have to be added to. I can give you a better example of that. I had a procedure in December, and when I got there, it explained to me that this was, even though it said the hospital name, it technically was not the hospital. So I had to pay a fee for that facility because it was not now if it had been in the hospital, I would have had to pay the fee. But since it was in a facility with the hospital name on it, but it wasn't
Hmm.
technically the hospital, there was a fee for that. And because the anesthesiologist was not part of that hospital, I had to pay a fee for the anesthesiologist. So even though yes,
Yes.
the health insurance covers those things, but the hospital, when you look at it, there's so many other things that are not. And you always get these double little bills, these little things for $25, and this other type things that add
Yeah.
on. So we have to hold these hospital systems accountable. And they said, get the bill, request, even if you're on Medicare, get the bill if you're in these churches, your churches, and start comparing. And just say, look, why is this for me was only $75, and for her it was $750. And one more piece on
Yeah.
that, when I was in the hospital 7 years ago, I had brought my medication with me to
Mhm.
take. And they said, no, you can't do that. Well, when we got Sister Minor asked for the itemized bill, I realized why. For that one pill, it's a pill, one pill, it was like over $200. And the reason it was
See.
over $200, there was a charge for the pharmacist. There was a charge for getting it from the pharmacy to the floor. There was a charge from there at the floor. There was a charge for the nurse bringing it to the room. It was a charge for the nurse administering it. Now I had them I had the bottles and everything there, my prescription. I could have took it and done it for free for what I already had, but the kingdom ended up. So you need to look at these things and need to hold the hospital accountable. All right, that's it. That was the only thing I wanted to
Oh
add.
my goodness. So we really need to ask questions, educate ourselves,
Yes.
have this kind of conversation. First, let me say this: we're going to take some questions. So if you all have questions, go on ahead and start popping them into the chat. Thank you, Dr. Miner, for literally decades for being such an advocate and for getting information and not only bringing information but actionable steps and resources into our faith community. We definitely appreciate this because this information is so incredibly needed. So we're going to take a few moments now and see if we have any questions. And team, if y'all can help me as well to see questions, and we will go on ahead and take some of those right now. Let me see if I can find any. I'm seeing a lot of thank yous. And as a community advocate, case manager, you laid it out well. So, Dr. Miner, there are a lot of thank yous and kudos and appreciation comments in the chat, but I do not see any questions. So we're going to go on ahead and we will actually have another question period at the end. But again, thank you so much for this information. And we realized that this was a lot. This is why you all, these are, if you're not aware, all of these webinars are on Facebook, on the Hope NBC Facebook page. We also have a YouTube channel. So there are replays that are available. If you want to go back and look at the information, if something clicked in your mind, but it didn't stay in your mind, like what happens to me, you can go and watch the replay. And also you can share the replay with other people, because just as we saw so many ones where people were saying, I learned something new, there are others that need this information as well. Our people perish for lack of knowledge. So again, thank you so much, Dr. Miner. We do appreciate it. Okay, so now we're gonna, I'll come back to that comment. Now we're going to turn a little bit and we are going to switch and we will hear from y'all the change of name, Dr. Linda Carper. Congratulations about our upcoming regional meetings. Dr. Carper.
Thank you, Sister Nettie. I really appreciate you. As you've heard, Hope provides so many opportunities for us to share. And so we want you to plan, save the date, mark your calendars. We actually want you to attend the Southwest Region 2 Hope Regional Conference. The information is on the screen, but we want to let you know that Friday, March 7th and Saturday, March 8th, the Southwest Region 2 Regional Conference will convene in Shreveport, Louisiana, and our host church is Morning Star Baptist Church, where Dr. Theron Jackson is the pastor. So I am your Southwest Region 2 Regional Coordinator, and it would be great to see you in Shreveport, Louisiana. The registration fee is only $50, and you will find more information about our Southwest Region 2 and other upcoming regional conferences on our NBCUSA Hope website. So please check out the website for more information and registration details. And we do hope to see you at one or more, you can attend more, of our upcoming regional conferences. So back to you, Dr. Miner or Sister Nettie.
I'm gonna take it from there. Thank you so much for the sharing. Louisiana. Louisiana. Now, I do see questions. Y'all keep putting them in the chat. We will circle back to them at the end. So know that they are seen, and please continue to put those in. Thank you so much. Thank you, Dr. Carper. Now, we're going to bring in Sister Bettina Campbell, and she's going to share a bit about one of the health observances we mentioned earlier that we're having for February, and that is National Black HIV/AIDS Day.
Thank you, Sister Nettie. Friday is National National HIV/AIDS or Black Awareness Day. And so what we want to do is let you know that studies show that cultural and structural biases and racism, HIV stigma, discrimination, homophobia, poverty, lack of access to health care, and lower awareness of HIV status contributes to the epidemic in the Black community. As a result, HIV has a disproportionate impact on the Black population. In 2022, Black people accounted for 38% or 14,553 of the 37,981 new infections among persons ages 13 and older, but only accounted for 12% of the US population. The disparities in HIV prevalence is also clear. In 2021, 40% of all people living with HIV in the United States were Black. Let's make Friday a day that we dedicate to raising the awareness of the disproportionate impact of HIV on Black communities and the importance of increasing access to testing, to care, and to prevention services. If you would like more information, please email info@hopenbc.com. Thank you. Back to you, Sister.
So important, so important. Thank you so much. Thank you so much, Sister Campbell. And it is this Friday, correct?
This Friday.
This Friday. Okay,
Yes.
Thank you. And you all, again, if you need any additional information, please do hit that email and we will definitely get something for you. Okay, so now it is time for our monthly Let's Move National Baptist update. Just a little bit of quick information. Whoop, whoop. Okay, and we would like to start, first of all, by saying Happy Black History Month. And we would like to uplift a Black History Health fact. Let's go back to the chat real quick. Y'all put a 1 in the chat if you are familiar with Onesimus. Let's do it the other way. Put a 0 if you're like, what is Onesimus? It's not a what, it's a who. Has anybody ever heard of this or him? Okay, y'all, Onesimus, he was an enslaved African in Boston a couple of centuries ago. And this man introduced a truly life-saving medical practice that is under a lot of talk right now with the ongoing confirmation hearings for the Secretary of Health. He knew how to prevent smallpox, which was an outbreak at that particular time in the United States, because for generations, his people, our ancestors had been doing this. He told his enslaver about something called variolation. This is a technique that came from Africa where they would expose a person to smallpox, but do it in a controlled way. Guess what? To do what? To build immunity. Basically, he saved not only, well, his contribution, they rejected it at first because they were like, okay, how can an enslaved African tell us anything? They rejected it for a while, but once they started doing, it saved countless lives. But more importantly, it laid the foundation for vaccines. Y'all, the roots of vaccines come from Black people. So we want to lift up his name and have us to just consider, why are so many contributions that Black people make in science and medicine often erased? And what can we do to just kind of break this cycle of dismissing and to demand respect for our Black expertise? I love that, celebrating Black. So that was like your Black history fact for Black History Month. Really quickly, let's go on to the other things for Let's Move National Baptist. This month, our February focus is on faith, fitness, and heart health. There is an article that has been written that talks about some of those connections, and it connects us with heart health. And so we're going to drop it in the chat. It's also in the Let's Move National Baptist band. It's not only for information, but it also does give some take actions and things that you might want to consider in your church ministries or your personal family to kind of improve your health, that can be done not only during the month of February, but ongoing. We also do want to remind everyone on the next slide to remember to do your tracking. Make sure that you're doing your monthly reporting. The document I'm going to put in the chat also has your tracker pages. Remember to put your minutes and so that we're tracking and looking for progress as we go year over year. And we also would love for you all to mark your calendars on the next slide. The date is, I believe, February 27th. That is a Thursday. That is going to be our monthly wellness questions answered period, where you can kind of submit some questions. We'll go through them, those answers. So it's kind of like one-on-one fitness / health coaching done, well, your specific questions answered in a group environment. So if you would like to take care of that, just go on ahead and hit that bit.ly. Again, I'm going to drop a document into the chat, and it will also be in the band that we have for Let's Move National Baptist. So keep on moving. And if you have any questions, just reach out to us. We're here to support you. Now, moving on. We would like to remind everyone of another very important resource that can help us to be well and to help others be well, and that is our self-paced health ambassador training. Okay. Now, to receive credit for health ambassador certification, you have to do a couple of things. You have to email info@hopenbc.com to register. Have y'all caught that? That's like a catch-all email. You have questions, you can send them there, and we will get right back to you. You can request a copy of the lesson training guide at that email. And then after the training, you complete a training survey that is at hopenbc.com/training-survey. Include in the email subject line NBC USA Hope Ambassador Training so that we can route it to the appropriate person. And let's not forget all of our February suggested health and wellness observances. We mentioned them earlier. It's American Heart Association Heart Month, the Go Red Day that is on February 7th, the National Black HIV/AIDS Awareness Day that is going to be on this Friday that Sister Campbell reminded us of, and our NBC USA Hope Wear Red Sunday on February 16th. You can download a complete list of our annual health observances from our website, hopenbc.com. And that's a very helpful resource so that you can get ahead. You can do some pre-planning and actually build your calendar of health ministry events around that. Our goal is that we can have some synergy by having churches across the nation talking about the same thing, educating, praying, taking action around the same thing. So please, if you have not done so, download that calendar. And let's make sure that we're putting this information out to our congregations and getting people informed and active and taking action so that we can be well. One more reminder is we want to remind everyone that Sunday, March 2nd is NBC Hope American Kidney Fund Sunday. And on that Sunday, we will be sharing more about kidney health. For our Kidney Sunday and our other healthful observances, I mentioned that you can go to the website. You can also email us at info@hopenbc.com for additional resources. We are basically just here to support you. Now, we already mentioned, Dr. Carper mentioned that our first regional meeting of this year will be in Shreveport, Louisiana, March 7th through 8th. We hope that you will join us there. Okay, so I recapped it all. And I think we have covered a lot this evening. But as always, Dr. Miner or whoever's hosting, they say it at this point, like this is like one of the best parts coming now, and that's where we get to hear from you. So it is time for our Q&A period. There are some questions that are here, and I'm going to pull those up. Continue to put in additional questions as you have them. And after we go through these that are in the chat, then you can also raise your hand. You can do that, and I'll be looking for those as well. So Dr. Miner, if you can come on, I'm going to look back and see what the questions are. Okay, here's one for you, Dr. Miner. What would be our best resource to take to try to eradicate some of these issues? Of all of the things that you've mentioned, what's our best take action?
All right, well, I'm going to reveal something about myself that people may not realize. In another life, I sold automobiles. That was back in the 80s in the Boston area. And I love to sell trucks. The reason I love to sell trucks, unlike automobiles at that time, trucks did not have a price on them. It had a label with all the features, but there was no price. So when somebody would buy a car, they saw the price on the automobile, and we ended up with a deal, but it would be based upon what they saw on the label. Okay. But for the trucks, there was no price. They had no frame of reference. And so whatever I come up with, I tell them we're losing money, and we might be making $4,000. And I use that example because it's the same way when you go to the hospital. If you go to the grocery store, there are prices. If you go to buy a stereo, I'm dating myself. If you're going to buy a turntable now, because they're back in vogue now, they're going to be prices. And you're not going to buy anything until you compare prices. Well, in the hospitals, there's no any prices. It's either you got insurance, but that's kind of changed a lot because of the deductibles and the co-insurance and everything else. You still get hung up on it because you got to pay so much out of your pocket. So the best way we can look at it is start comparing ourselves. I know it sounds crazy, and you get sick, and you don't want to do it. But whether you're on Medicare or employee insurance, I really asking our congregation across the National Baptist, and you can just start getting a detailed bill. Start comparing bills. Start looking at these things. And then what you can do, you come back and say, wait a minute now. I went in for gallbladder surgery, and you said it was $75,000. Well, a member went in for my fellow member went for gallbladder surgery, and it was only $10,000. And that's what we're going to have to do. We got to have some of these conversations about what is, and ask questions. They get us at our weakest moment when we're sick, and now we're asking about things and whatnot. We have to ask. Now, I will say this. This is going to sound funny to you all. If you pay cash, you get a discount. I had a procedure several years ago at the Cleveland Clinic. At the time, my insurance didn't cover it. They felt sorry for me because my health insurance did not cover it. So they gave me a 40% discount. Now, had I had insurance, it would have been more money. So those things come into it as well. So let's do that. I know it sounds crazy. But ask them for a copy, a detailed copy of your bill. There you go. And also, I should say there are some people who are chaplains, and start having some discussions, and really be wary of the for-profit hospitals as opposed to the non-profit hospitals, because just what it says, for-profit, they're trying to please shareholders.
Ask questions, ask for discounts. I never knew you could do that in that particular thing. And I think it's also what I'm hearing, because you mentioned sometimes you're not well at that particular instance, and a lot of times, and you may not be up to it. It's also important to have a supportive team, to have an advocate to be with you, family member, a friend, just somebody that can be trusted and that can, advocate for you when sometimes you're not able to advocate for yourself. Okay, so I thank you. That was a great question. Another question. This is from Sister Hickman. Are the sites back up? I heard they were down. Are you referring? They're up.
Well,
okay.
Right now you can go to NBCUSAinc.org and somebody can put that in the chat. But
can you say that again, Dr. Minor?
NBCUSAinc.org. But now, understand this: the Hope page is separate, and it's never been down. So it's good to go. HopeNBC.com is good. Thank you for putting that there. And somebody also put it on our Facebook page as well for this. But that's where it is. We're making some changes to it, but it's there, and we're good to go.
Okay, thank you. Another question. Who do we need to write about Medicare, Medicaid?
If I had not gone to this conference, the thing I would tell you, they said write or call your email, whether your congressperson or your senator. That's not true. Depending on where you are, if it's a red state or blue state, it probably won't make a difference. The actuality is that working, and I don't have, I apologize. I did not want to share the information because I didn't have all the information, but I'm trying to work to get the districts for those 12 Congress people on those swing districts. As you may or may not know, there's only about 2 or 3 seat margin for the Republicans in the House. So if you got 12 people who said, look, I cannot afford to vote against the AC, the Affordable Care Act, or Medicaid. So I think as we talk to those 12 people, and we'll work, and we'll email us, we'll try to find find out who they are. I know some of them are in New York State and some of them in California, that those swing districts. But they came to them and told them that they want to cut, and they said, "No way, we're not touching it." You understand? I'm a business owner. I'm a farmer. And when the Inflation Reduction Act came out in 2021, I'm able to come in and get coverage instead of saying $750 a month. Now my coverage is $150. That's a big difference. $600 is a lot, a lot.
Mhm.
So now you're gonna come back and tell me that my bill is gonna go. I voted for you now, and my bill's gonna go from 150 to 750 or more. I'm not gonna be very happy because you're taking something from me. Remember, in America, once you give somebody something, it's hard taking it away. People will fight like a baby. You take away that bottle, they get upset because
That
you're taking
cookie.
something away. Right, you're taking something away. Mhm.
Okay, so thank you for that. A comment, it's when you were talking about, I guess, the bills, it says, wow, that's real talk. We didn't know how much the surgery was until we received the bill. Thanks for helping us with the fact that we need to ask more questions. And right after that is another question that says, do we need to get full bills for doctor's visits as well, in addition to hospital visits, procedures, things of that sort?
Yes. So let's understand something. I want to be clear. Let me just walk through this again. Now, in most areas, your doctor is no longer independent. For instance, the doctor system I went to, they were independent of their own practice. And over the last several years, they, along with other doctors' practices, have folded up into the hospital system. So right now, nearly all the doctors here in the Memphis area are a part of one of the two major hospital systems. So even though, and what caught me, I got a bill from the hospital a few years ago. I said, I hadn't been in the hospital. Opened it up. It's my primary care physician. Because now they're part of the hospital system, the billing goes through the hospital system. So when you're doing this, it may end up being more complicated, more convoluted, and they may give you around the world, but do that. Now, one other thing they do, let's be clear on this. Although the Affordable Care Act covers preventive care visits, there's some things that are not covered. I'm always always find it interesting that my primary care physician, every time I go for my annual checkup, my semi-annual checkup, she wants me to get my carotid artery checked. Well, that's not part of the things that's on the for the Affordable Care Act coverage. And I know why she wants me to get my carotid artery checked, because that's an extra bill for her that my insurance is not going to cover. I said, no, I'm fine. I'm good. So what ends up happening, even though I had the expectation I was going in and it was going to be covered for all, they're going to find a way to put something in there that you really don't need. So again, just have an understanding what those things are.
Okay. Another question.
I got a question
Yes, sir.
popped up from social media here.
Okay.
Somebody asked
Okay.
about, can I share at their church or something like that? Well, as part of your Hope team, yes, we go. And of course, we would prefer to be at an association, a group of churches, or a state convention. But let us know. We don't have a problem going and sharing. I know we do a lot by Zoom, but a lot of people still, even this day and time, would like to come in and say, press the flesh and ask questions. Again, what we're going to do, Sister Nettie, info@hopenbc.com, and we come out and we can be more than happy to share with you.
Wonderful. I think I see one more question. Thank you, Dr. Carper, for directing me to the area where it was. Is www.mdsave.com a good website to use to shop for affordable medical procedures? This website was recommended to me, but I have not used it yet. It is supposed to compare prices and give you prices for several locations near you.
Well, I've always been wary about those sites simply because it's all about your hospital services and your doctor. For instance, a while back, I was looking at different ways of getting a procedure done, and I said, "Oh, well, I could probably go over this." But then I found out that the doctor who I work with does not, their practice does not participate with this hospital. So in addition, if you can use it as a starting point, maybe looking at it, but you want to see who your doctor is affiliated with, because they're real ticky. If you go to have a procedure somewhere else and whatnot, they'll say, well, we really don't want to work. We really, really don't work with them. So if you go over there and do this, then they're not going to go with you. I mean, they're going to go with, but they're not going to participate in the aftercare. Because if you go through the procedure or something, you still have to do that follow-up and everything with everybody else. And I've learned the doctors really, I remember when I had to have surgery on my vertebrae, and I had a test done in Selma, Alabama. They had it all done up. As a matter of fact, I looked at it the other night. They did it on a CD, gave it to me, sealed it up. When I got to the hospital here, and I said, no, we got to do it ourselves. So now, even though I had it already, it was done in Selma, Alabama. They had to have the same thing done here that told them the same thing I already had. So the bottom line is that you'll have to ask them about what it is. Now, let me just close this whole thing with this. There are 3 hospital systems in the area I live in, Memphis, Tennessee. 3. And you say, oh, that's great, Dr. Marty. You get the choice of 3. No, I don't. You know why? My health insurance.
Right.
My health insurance is only affiliated with one of the 3. My health insurance is only affiliated with one of the 3. And so although I might go and do all this price test and everything else on it, I have to go with the one where my health coverage is. But I do ask questions. I do ask them, and I tell them and whatnot. And sometimes the bills are high up and they come out and ask me to pay something. My wife would get on there and say, look, this is just too much. And just don't pay it. You have to. Sometimes you have to get crunk sometime with them on it. And just do that. Okay.
See, one more question, and then I have a question for you. Are
Okay.
there roles that are advocates that help navigate this intricacy for individuals? Does such a thing exist?
Well, that's why
Like
we do this.
professionals?
That's why we're doing this webinar. We're trying to work through one of the things that I talked to Pastor Montgomery on. We're trying to do another add-on to our health ambassador training to just to do what we talked about tonight, to have this so people can come in and do it in their churches. We're looking to have it church-based because every situation is going to be different about what things are. Because medical care is local. It's a local thing. I'm just going to tell you. And so what we're hoping to do is we want more people to become health ambassadors. And as they become the basic health ambassador training, they will come back and take. We're working on it. Y'all just pray with us. We're trying to get through some other ongoing issues now. This change in the presidential administration at the national level. But once we get through this, we hope to share some more about it during the National Baptist Congress in Montgomery at our table. But we understand this, and we're trying to work on something that we can have for you so you can be an advocate. We're really hoping that this will also become part of marriage counseling, whether it is when you are getting a couple that getting married or later on talking about things, that the spouses can learn these things and do where things are. And I see the comment in here about the patient navigators and others. Yes and no, it can be. But if they are working for the hospital, there are sometimes only so far they can go and what things they can do. I'll give a quick example. I've had some members who didn't have health insurance, and they were getting ready to get hit with a big bill. But I had hipped them and told them, I said, look, when they come with you with a big bill, you let them know that you need to talk to somebody in their charity part. You let them know. And what they did, that's exactly what happened. So they went from the person saying, we need this, that, and the other. Once they switched them over, they got a prescription at no charge to go home. And then we connected them with a federally qualified community health center. Okay, and give those. She didn't know, her family didn't know, but her pastor knew. So one of the things we want to be able to do is get our churches up to speed, educate them on that as well.
I think that's fantastic. And possibly even identifying, since you mentioned it's such a local issue, identifying where God has already provided us with individuals within our congregations that have that. And I'm not saying they're taking on a part-time job, just answering, everybody in the world, but to know who those individuals are, and we leverage the strengths and the expertise that we have within our church community. I think this is great. These were a ton of questions. And can I just ask one more thing for
Yes.
Dr. Miner as we close out? We talked a lot about insurance. Can you give us a word that this is something that I tend to stand on a box? Healthcare should be a right, and insurance is a blessing. And if you have insurance, when you have it, please use it. Please get your preventative care. Please get the things that are there for your preventative health care, the knowledge of yourself, knowing your okay, I'm asking a question and I'm kind of let me step down off the box. Yes, sir. What say you?
Well, I think I hit the nail in the head. I think one thing we got to do now is we got to take better care of ourselves. The biggest hit that I've had, and I've been doing this since 1998, and I still get it to this day. And they talk about grandmama and them and how all the things they ate and things. I still, in the 21st century, I still get this response. I have to explain to them, yeah, they ate all that bad stuff, but they also went out there and chopped cotton and all this other stuff and worked it off and everything. We eat, and what do? We go lay down somewhere and everything else.
Right.
One of the things that we're going to try, I don't know how much we're going to do it this year, but hopefully we're doing more in 2026. But one thing through Hope, we're trying to encourage churches to do more exercise spaces in their churches. And guess where you can get the equipment from? People have buy equipment the first of the year when they make their New Year's resolution and never use it. Tell them instead of letting it sit in their garage. Right now, and we set up one of the spaces in our church as an exercise room. We have 2 stationary bikes and a treadmill. And we start having people go in and use a treadmill. So little things like that. If you got a fellowship hall, guess what? You got an exercise room. The only thing we say, and if you need a copy, we'll give it to you. Make sure anybody that's going to use it signs a waiver.
A waiver,
because
yes,
you want to
sir.
make sure that somebody says, "Oh, I'm good." And you go there and you just fall out. But again, we're finding a lot of people are getting afraid to walk in the local park or wherever place it would be, but they feel comfortable going to the church. Plus, the more activity you have around the church, the more it feels like a community and other things you have. But we're working on that. Look, Dr. Kimber has really pushed us to make sure that this is your new National Baptist. So we're trying to come up with some more things from your Hope Health Ministry that we can share with you to make things better for you and your local congregation.
I love that so much. So much. Oh, this has been phenomenal. Thank you everyone for your comments. Oh, they keep coming. Yeah. And somebody also mentioned that okay, I'm just gonna say this and then we're gonna move on. Dr. Miner, do you see this? You mentioned about the food. It says and grandmama and them. Like I love how it was written and them, like phonetically. Okay, that has meaning. Their foods were not loaded with hormones, chemicals, and etc. And to kind of close out this question and answer, it says, yes, a poor excuse reflecting on past health of our ancestors. Not only were they very active lifestyle, but their food was from their farm. So much. I love all of this. Thank you so much, Dr. Miner and
thank you, Sister
Dr. Carper, Sister Campbell, everybody for this sharing. And thank you to all of you that have been so active in the chat and you're listening again. Undoubtedly, there is information that if you didn't, I'm sure you learned something new. And beyond that, there are other people that maybe aren't on these webinars often that need some of this information. Even if there's one piece, it can be so critical for them continuing to take care of their health or being prepared for something that may be coming down the line. So again, we encourage you to share the replay and encourage people to check it out on Facebook, on YouTube, where it is available for them as well. And look for other great things that are coming from your National Baptist Convention Hope team. As we get ready to close out, we just want to let you know what is coming up, the agenda coming up for March 4th webinar. Remember, we meet on the first Tuesday, unless something really, pushes us off the calendar. It's the first Tuesday of every month. So on March 4th, mark y'all's calendars, we're going to talk about National Colorectal Cancer Awareness Month. It's also National Nutrition Month. We were just talking about food World Kidney Day is March 9th. We're also going to be lifting up these days National Women and Girls HIV Health Awareness, HIV AIDS Awareness Day, which is March 10th. How many of y'all love Taste Test Sunday? That's coming up on March 17th. We also have in March the American Diabetes Association Alert Day on the 28th. And then World Health Day on April 7th. So we're rolling into April. Again, you can download our health observances on our website, and we hope that you will do so. Again, our website is hopenbc.com. Our Facebook page is National Baptist Convention USA Incorporated Hope Health Initiative. We hope that you have followed that page so that you can get the updates. Dr. Felisa does a great job sending information out on our Facebook and social media regularly. So make sure that you follow that page. Our Twitter feed is at Hope_NBC USA, and our YouTube channel is NBCUSA Hope. Now, if you would like to enroll in our Hope Health Ministry training in person, self-paced online, again, the email is, y'all say it back to me, info@hopenbc.com, right? Or you can call, this number is 901-603-0762. All righty. And y'all, we definitely do value, not only appreciate it, we beseech thee. Okay, we're going to say it that way. We beseech thee to please give us feedback. It is very important. So we request that you complete our webinar survey. They're pasting the link in the chat, and you can always find it. It's very easy at hopenbc.com/webinar-survey. It's the same one each time. So please do fill that out and share your comments. We do value your input. We appreciate the tireless work of everyone on the NBC USA Hope team. Our leader, our faithful leader, Dr. Michael Miner, Dr. Desi Levy, Lottie Miner, I'm Nettie Johnson, Pastor Dexter Morange, Ellen McKnight Hill, Dr. Felisa Washington, Minister Geraldine Moore, Loretta Miller, Dr. Lavoria Williams, Bettina Campbell, Dr. Marion Talley, and Thomas Duke Robertson. We also want to acknowledge and thank for their work our 7 regional coordinators, Pastor Daniel Blackburn in Northeast, Brooklyn Rogers in the Southeast, Pastor Bernard Montgomery, Southwest 1, Dr. Linda Carper, Southwest 2, Teresa Fales Farr in the Midwest, Tafara Robinson in the West, and Pastor Richmond Johnson in the far West. If you want to connect to your regional coordinator, you don't have to remember a different email. It's that same email, info@hopenbc.com. And if you have any additional comments or questions, we're here for you. We're going to formally close the evening's webinar in just a moment to come off of social media. But for those of you that are in Zoom, we'll open the mics for any additional questions, comments that you may have in a feedback session. We thank you for attending today, and we look forward to sharing with and seeing you again on March 4th for our next TempleCare Matters webinar. And finally, we acknowledge our president, Dr. Boise Kimber. He reminds us that we are changing the course, but not our conviction. The gospel still works. This has been a production of the National Baptist Convention USA Incorporated, the nation's largest Black denomination. You take care. God bless. Be well. Bye-bye.